So I'm going to be looking at challenges and outcomes of prenatally diagnosed open neural tube defects, which is a case study which was done in a low resource setting from Salim Gabe Central Hospital. Okay, sorry, I'm having a problem with sharing my slides. Okay, open neural tube defects have an estimated prevalence of 0.7 to 2.5 per 1,000 live births worldwide. In high-income settings, prenatal screening programs have led to early diagnosis of open neural tube defects, allowing for informed early decision-making and optimal management. So as we all know, we don't have ultrasound as readily available as would like to have in low resource settings than in high income settings. Therefore, we don't get to diagnose ONTDs on time, and therefore our patients don't have can't make informed decisions, and we can't manage the open neural tube defects optimally. So, however, in Zimbabwe, information that is used is based on postnatal outcome studies and information adopted from developed countries. As a result, ONTD's management presents a challenge in low-income settings, leading to very high mortality rates of the neonates. Identify the incidence of open neural tube defects in the fetal medicine units in Zimbabwe, the rate of termination of pregnancy. Those are objectives to describe the short-term outcomes and challenges faced for infants born with open neural tube defects, and to describe the challenges faced during management of the neonates that are born with open neural tube defects. So for the research question, what are the outcomes of prenatally diagnosed open neural tube defects in low resource settings? What is the role played by folic acid in preventing the development of ONTDs? What are the challenges faced by both mothers and neonates that are prenatally diagnosed with open neural tube defects? So as our justification of the study, determining the postnatal outcomes of congenital defects plays a huge role in the management of future prenatally diagnosed defects, and it aids counselors to use information that is based on factual outcomes from research. Like I mentioned earlier, we're currently using information from the high income setting. The study design was a retrospective cross-sectional study design, and study population was all women who delivered babies that were prenatally diagnosed with open neural tube defects at the fetal medicine unit in Zimbabwe from February 2020 up to February 2020. We came up with a sample size of 100. The inclusion criteria was all pregnant women with single-term pregnancies who had been diagnosed with open neural tube defects at any gestational age, who delivered babies at the Salim Gabe Central Hospital. And the exclusion criteria was all women that were not scanned at the Salim Gabe Central Hospital. Data was collected from medical records of women who delivered babies with ONTDs at Salim Gabe Central Hospital and standardized using a data collection form. Ethical consideration, ethical approval was obtained from Medical Research Council of Zimbabwe. So for the result, as we can see, we had a sample size of 100, but we managed to come up with a total of 60 patients. So of the 60 patients, 24 opted for termination, and 30 patients decided to keep their pregnancies up until term. But of the 36 patients that kept their pregnancies up until term, 67% of those had alive births, 28% had IUFD, and 5%, that's 2 of our patients, had spontaneous abortions. So those were the outcomes. So continuing, answering our second research question, which has to do with the effect of folic acid intake on the development of open neural tube defects. we see that from the pie chart on the left, 56.67 of our patients did not take folic acid at all. And then 10 patients did take folic acid in the first trimester. 20% of the patients took folic acid in the second trimester, and 13.3 patients took folic acid in the third trimester. And on the right, we have the challenges that were faced by the neonates, and by both the neonates and the parents of the neonates. So we so some of the neonates had surgery after birth. Like I said from the previous presentation, we had 67 alive births. So from those 67 alive births, some had surgery done and some died soon after birth. So this is just a rundown of the neonates that survived after the surgery and some that did not survive. So for the discussion, in this study, 40% of the cases opted for termination of pregnancy. And neonatal mortality rate before surgery was 33.36%, and almost 90% after the surgery was done. In the studies conducted in Vietnam and Nigeria, the neonatal mortality rates were 83.3% and 92.3% respectively. These findings suggest that prenatally diagnosed ONT often lead to very, very poor outcomes, especially in low resource settings due to late detection and also lack of information due to lack of information on folic acid intake. So most of our patients, when we talk to them, they didn't even know about folic acid. They did not take folic acid before conceiving and only got to know about folic acid during pregnancy when the defect was diagnosed. Studies have shown that folic acid supplements before and during pregnancy reduces the risk of neural tube defects, as we all know. In Zimbabwe, although the termination of pregnancy is available as an option, fetuses with ONTs, most women choose to continue their pregnancies regardless of lesion levels, despite the possibility of significant disability and the potential need for long-term assisted care because of cultural and religious beliefs. So like I said, 36 of our 60 patients decided to keep their pregnancies. The ethics that around the fact of having to terminate pregnancy. In low resource settings, the lack of resources, including trained personnel and diagnostic tools, can pose a challenge to the diagnosis and management of open neural tube defects. Moreover, the limited access to specialized care and interventions impact the outcomes of prenatally diagnosed open neural tube defects. So that's it on my presentation.